Okay, so today I'm going to be talking a little bit about the FDA-2 assessment, which is known as the French dysarthria assessment. The purpose of the FDA-2 is to evaluate the muscles used in speech for individuals who are suspected to have dysarthria. And dysarthria is a motor speech disorder that impacts the muscles and the ability for the muscles to produce speech. So, with dysarthria, a person knows what they want to say, and the brain is sending that correct message, but there is an issue going on with the muscles. Okay, so when I was reading the manual, I got a bit confused at one part, so I had to redo this. Um, okay, so the assessment age range is 12 to 97 years of age, and then it's given to individuals who are, of course, suspected or diagnosed with dysarthria. Now, the manual does state that it can be given to children, but it must be administered with care. So it's not specifically standardized for children below 12 years of age, but if a clinician uses it as a tool to kind of see where those breakdowns occur in the speech for an individual who is under 12 years of age, then it can be used as a clinical tool, but it's not standardized. Okay, so there are the major subtypes that are assessed with the FDA-2, and those include reflexes, respiration, lips, palate, laryngeal, tongue, and intelligibility. You can kind of see that here. That's what the scoring sheet looks like. And then under each of these big domains, there's different parts that it measures, like different subtypes. So for example, with reflexes, it's measuring the patient's cough, swallow, and dribble and drool. And then it keeps doing different subtypes under each specific category. Okay, so again, the FDA-2 is used when dysarthria is expected in a patient, and it's used to look at how well someone's speech muscles are working and how severe the speech difficulty is, so that you can have a baseline and then track treatment and planning over time. I also wanted to point out that dysarthria can be developmental or acquired. So if a patient is experiencing certain signs, and this could be like slurred speech, reduced intelligibility, their voice quality is abnormal, or there's difficulty coordinating those speech movements, then this assessment may be used to determine if there is any severity linking with dysarthria symptoms. And then after the test is administered, you may use your clinical judgment to decide which type of dysarthria you suspect the patient may have. And there's different types listed within the manual. They're all right here: flaccid, spastic, cerebellar, mixed, and extrapyramidal. And then it also goes into the different types of features for each type of dysarthria, so that helps determine which type the patient may have. So, doing the FDA-2 helped me realize how detailed a motor speech assessment can be, especially when looking at dysarthria. I really like this assessment in particular because it breaks down the different areas of speech. And so, when you're actually administering this to a patient, you can go back and then realize where those communication breakdowns are occurring. I also wanted to point out that when looking through this assessment, I realized how difficult it can be to differentiate motor speech disorders in general. Even when you're looking through these structured tasks, the characteristics can tend to overlap in motor speech disorders, and it can make it quite difficult to diagnose because it's not always clear cut.